He's had this behavior for days now. I think he's relapsing back into his psychosis.
Wait, I don't remember him being like this when he first came in.
I think he's under-medicated.
You mean over-medicated. That's why we're seeing
we're making too big a deal of this.
Well, has anyone asked the patient?
Sorting out a patient's psychiatric symptoms from what may actually be the side effects of taking medication can be a challenge for caregivers. Extrapyramidal side effects, known as movement disorders, can resemble both the positive and negative symptoms of schizophrenia or superimpose onto a patient's psychiatric condition, impacting staff judgment and patient care. National studies have shown that movement disorders affect from 18 to 70% of patients on psychotropic medications. In some settings, this figure is closer to 100%. If ignored or misdiagnosed, these side effects can have grave consequences.
They can progress. They can become more serious. They can become residual in that they won't go away easily or they won't respond to medication. And they sort of tend to erode the trust that the patient has in the treatment abilities of the staff.
Beyond that, the movement disorders are sometimes the early warnings of really serious trouble coming.
I can't sleep very well, and I kind of feel like I'm stiff all over.
Besides raising the potential for a dangerous adverse drug reaction, untreated side effects often result in a drop in patient compliance.
Well, John, just listen to what I have to say first, and I want you to give it some thought. Think about it. One is the social skills communication group.
Social? I'm not a social person. I like being by myself, really.
We use medications that so frequently produce movement disorders that they're seen almost as part of the turf, what goes with using these particular chemicals. And that's sad because if patients have real problems with them, particularly if they're significantly discomforted, compliance with taking the medication goes way down, and of course, ultimate therapeutic success goes down.
Movement disorders affect many facets of a person's life, posing obstacles in their efforts toward recovery and independence. For some, sitting still and concentrating for a class or therapy group can be an impossible task. Certain side effects can pose major problems in the workplace. Those who work with their hands in trade or technical fields can be profoundly affected. While the negative public perception and stigma that may arise can seriously impair one's efforts to reintegrate successfully into a community.
The stigma of mental illness in this country is enormous, and the stigma of heavily medicated mental illness is even worse. We feel that there must be something bad wrong with people, that we can't trust them, that they're dangerous to be near. And when you make it obvious, you make life much harder for the people who are trying to deal with just getting through the day.
I don't know what to think about the delusions right now because he's so new to us. It might be a while before we start to really see the real Mr. Miller.
Right.
But I think he's...
Oh, there you guys are. I just got word from the program office that you've been approved to attend that class on movement disorder.
All right. Yeah.
When's that going to happen?
Next Wednesday at 8:30.
Oh, we'll be there.
For mental health workers, being well educated about the symptomatology and assessment of extrapyramidal side effects is essential. Regardless of one's role or position on the treatment team, having a basic knowledge is fundamental in providing quality care.
Today we're going to run through the various kinds of movement disorders that our patients can have, and I will do a little miming of them.
Dr. Fred Rowley of Atascadero State Hospital in California has been educating caregivers for over 15 years on the subject of movement disorders.
You see the word dis is a common root word in medicine. It means difficult, unusual, painful, not normal. We then break it down into the different roots. The first one refers to your muscle tone.